Thriving in 3 minutes. How to thrive with your procedure in 3 minutes. What procedure are we doing now?
We are doing dilute calcium hydroxylapatite for the inner arm crepiness that a lot of women get after going into menopause.
Yeah, you know, I don't see many patients with this.
Well, you're a facial plastic surgeon,
Oh,
so
maybe
don't
that's
they
why.
come to you for the face?
Do you see a lot of this?
I see a lot of it. I mean, honestly, I think after the neck, the inner arms bother women the most after 50.
Actually, I've heard a lot of women complain about it, but it's not something we offer much of, so I'm willing to learn from you. I'm always learning from you, aren't I?
Well, because I have a lot to teach you.
Oh, okay, let's get to it. Show me how to do it.
So let's define the area. So this is kind of like the inner arm area. It's usually this space between bicep and tricep medially along the arm. For whatever reason, that skin tends to be less adherent to underlying fascia, like the outer arm skin, like where the delts are, and it also tends to be a lot thinner.
Are these patients older, younger? What?
Menopause. I feel like menopause really brings it in. Yeah, and so...
and surgical options aren't really great here.
No, because you're going to do a brachioplasty and get a scar along the whole aspect of posterior aspect of your arm. People don't really like that, and it doesn't change the quality of skin.
Okay, show me how you do it.
Okay, so I define and mark that area. I may come down all the way to the biceps tendon distally. Just be careful there because you don't want product to conglomerate. But like you see in her, it's usually a little bit, I cut it off before I even get to biceps tendon. And then I do these little numbing dots along the outer
numbing
aspects.
Dots with what?
1% lidocaine with epinephrine.
Okay.
And then I take an 18 gauge pilot needle like you see here in the video. That's my introducer.
Yep.
And then I introduce a 22 gauge 2-inch cannula into the space. Now again, this is one of the thinnest skins of the entire body. So you're really kind of scraping along subdermally and delivering your dilute calcium hydroxylapatite. Here I diluted it at a 2-to-1, so 3 cc's of normal saline to 1.5 cc's of Radiesse.
No, any lidocaine in that mixture?
I don't use lidocaine in the mixture.
Yeah.
I find I don't have to because if they've numbed in the area, that's usually enough, and just like the little numbing dots.
Why dilute?
Dilute because it allows you to distribute that calcium hydroxylapatite sphere a little more diffusely over the entire surface area.
And the collagen stimulation?
And then because it also shows more collagen stimulation in a wider surface area. If you don't do this, then you get a dense conglomeration of the calcium hydroxylapatite, and patients will complain that you can see chalk underneath their skin.
Okay, and what are you worried about when you're injecting this area?
Now, remember, I mean, you're seeing a lot of those veins. Think about those antecubital veins that are huge that we draw blood out of with like a 14 or an 18 gauge needle. So be thoughtful to kind of wiggle your cannula as you introduce, and you can kind of see me doing this right now in the video.
So really important, I want to mention this.
And look how superficial I am.
Yeah.
Like you can see it.
And if you hit a vessel, you're going to bounce off it. I've seen that happen before, and I've seen you do that. I've seen me do it. So I think that's really important, the way you're making that motion with your wiggling and you're being careful.
Exactly. And here I tell my patients you need at least 2 treatments in order to get a meaningful result. I kind of extrapolate.
How far do you separate those treatments?
At least 6 to 8 weeks.
Okay, 2 treatments, 6 to 8 weeks apart.
And I will commonly even layer this with a non-ablative fractionated laser like a Fraxel Restore immediately after to get even more collagen stimulation and benefit from, you know, the numbing.
Does it matter what you do first, the filler or
I do the filler first.
You do the filler first, why?
Because if you do the laser first, you've created a lot of vasodilation in the area. It makes it red with a non-ablative laser. So more at risk, I think, for getting into a vessel you don't want to get into and causing bruising.
There are some people, though, you know, who will do the energy-based device beforehand.
And they can.
Okay, how long do you tell people this lasts for?
Again, I tell them, come back in a year. So do 2 treatments and then come back in a year to maintain.
What's the satisfaction rate with this?
I'd say 90%. You don't have many options here, guys. I mean, you're talking about a non-ablative. They're going to need at least 3 treatments. That's like 2 weeks of redness and downtime, and then they may even pigment afterward. So there's not a lot of options.
How much total product do you use?
1 syringe per side is usually what I need, but I kind of think of it like a palm. You know, like one hand, obviously we'll have different hand sizes, but usually at least my size hand, which is a 5.5 surgical glove size, For each hand, you need about 1.5 cc's of dilute product.
Yep. And 90% satisfaction rate. How many things in life provide 90% satisfaction rate?
I can tell you something that provides you greater than 90% satisfaction.
Me?
All right, guys,
Okay.
so there you have it. How to thrive in 3 minutes when treating the inner arm.
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.